Okay. And I will turn it over to Dr. May.
Hi, I am Dr. Indea May. I'm clinical faculty from Wayne State University in the College of Nursing. Today I will be presenting with Ms. Josephine, and we're going to discuss telehealth, combating health disparities via access to healthcare. Next slide. And Josephine.
Oh, sure. What is telehealth? According to the World Health Organization, telehealth is the delivery of healthcare services by using information and communication technologies for the exchange of information. For example, to treat you, diagnose your situation, and prevent these disease processes. Now, that's maybe a mouthful, but let me say, if you are involved in a telehealth program and they're providing telemedicine support services for you, you don't have to leave your home. You can actually get your medication prescribed and also delivered. So why should we use telemedicine? Well, right now our world has changed. COVID-19 has brought a new threat to us, but altogether we have we will win, right? Because this is who we are as a people. So the practice cuts down one-on-one interactions between the patient and the doctor and the healthcare provider. And it's also useful in handling infectious diseases that we can see you on video, like a virtual visit, also a telephonic visit. So it is one of the things that I'm sure if you were to get involved, you will be very pleased. Thank you. Next slide. What's the definition of telehealth? Well, it's not a specialty in all of itself. So the definition is just delivering you healthcare services from a distance and using the technologies that we have to provide these type of services that you could also receive when you're in the office. And most people think that's not true, but it is, because you have an opportunity to have a live interactive video conference. One of the favorites of mine that we'll talk about a little later is remote patient monitoring. So we can store and forward your information as you please and be very, very cautious and understand that this information is strictly confidential. Thank you. Next slide.
All right, thank you. So we're going to talk a little bit about access to healthcare. As we know, older adults are more than twice as likely to require hospitalization compared to adults in middle age, with nearly 17% of Americans 65 years and older hospitalized at least once during the year, according to the CDC. So therefore, telehealth is very beneficial because it offers the patients a peace of mind to be able to attend appointments. No case managers are needed at the time. You can also have appointments for acute concerns in a timely fashion, and it is very convenient. Also, keep in mind that telehealth is HIPAA compliant so that confidential information will be kept confidential and secured. Next slide. Now, let's explore a few barriers to healthcare, because in order for us to pave the way for that great, convenient telehealth and telemedicine, we're going to talk about some barriers. So some of the barriers includes poor internet connection, and we'll probably discuss more of that with Josephine in regards to how to tackle that if that happens. Now, also barriers to healthcare could be phone or tablet compatibility. So sometimes your phone or the tablet devices that you have may not be compatible with the telehealth, the telehealth systems that each organization has. So it is very wise to do a pre or a prep call or try to get your device connected. Also, barriers are conflict with appointment time. Sometimes telehealth appointments may actually take place after the office closes, like after 5 o'clock, depending on your organization or your provider, and also provider wait time. So in regards to provider wait time, your appointment may be at 10:30 a.m., but keep in mind, your healthcare provider may have patients before you. So therefore, you'll be on the active line for that visit, maybe for a few minutes or more, but you just remain on the line until the provider comes on. Next slide. Also, research shows that technology and broadband internet connections are most frequently noted as barriers, and these really cause people to be hesitant about doing telehealth visits, and the lack of awareness and understanding of telehealth and its offerings, and also insurance coverages of telehealth. So those are things to consider as barriers, and you want to really dive into asking your insurance company about those things prior to your visits, as well as your provider's office, and they can provide information regarding that. So also barriers of healthcare are visits may go from video call to telephone call. I have seen that various times in my practice where we, my MA and I would be on the call with the patient. I would be able to visualize them, and then that internet connection would drop and we would have to turn it into a telephone visit. So be aware of those things. Also, lack of hands-on assessment. Sometimes as a provider, we need to physically be in the room with the patient to palpate, percuss, things like that, to really assess the patient. So consider those things when you do make telehealth visits, telemedicine visits, because you want to provide the complaint or the concern that you have at that time of your appointment, making your appointment. All righty, next slide. So with barriers of telehealth, we wanted you to consider those things, but let's talk about the benefits. Benefits of telehealth allows the patient to stay connected with their healthcare provider, no more missed appointments. So it's convenient. It allows you to do your follow-up visits. It allows you to see your provider for acute visits if there are acute concerns. And it also allows you, once again, to have that access to care. Also, it provides socialization by way of video chat. Sometimes you may have even more time to speak with your physician or your healthcare provider via those telehealth appointments than actually in the office. Options of video and audio, like we discussed, will be able to visualize you and or do a telephone visit. Also, increase patients' compliance. A lot of times we've seen that seniors miss appointments due to transportation issues, due to mobility issues, and other issues that may occur. So this will help with adherence to plans of care. Also, benefits of telehealth, you have acute concerns that are addressed conveniently. All right, next slide. Also benefits actually help decrease hospitalizations. We've seen that, and research proves that to be true because of the convenience and ease of the telehealth. Also, family members can also become part of that visit if the patient deems so, to help with that plan of care. Benefits also include decreased cost to patient and overall wellness cost altogether. Also, increased efficiency of patient planning and results. Patients are able to go into their patient portals, electronic medical records, to review their lab results, to to review their test results. Also, they are able to send messages, like text messages, to their providers as well and get timely responses. Next slide. And so this was just, this slide was the video of how to prep for a telehealth visit. And this system is like a Zoom call. So we can actually go to, if we have, is time permitting for us to see part of this video?
Yeah, we should be able to play the video.
Okay, so we'll play this video. It's a 6-minute video. If need be, we can cut it short, okay?
Review the steps to connecting with your provider at Crystal Run Healthcare via telehealth. Crystal Run Healthcare uses the HIPAA-compliant version of the Zoom application to perform telehealth visits. In preparation for your visit, please install the Zoom application on your device that you will be using for your visit. You will be invited to join your telehealth visit in 2 different ways. You may receive an email or a text invite at the time of your appointment. The text message contains a link. Click on the link and follow the prompts to review and update your demographic information. Once complete, you will see a link to join the provider for your appointment. The other way that you can be linked to your provider for your telehealth appointment is that you will receive a personal meeting ID by the clinical team at Crystal Run Healthcare. Your provider's clinical team may call you prior to the visit and provide you with the meeting ID. You can use the meeting ID to join the visit if you have not received the text link. To prepare for your visit, you should first begin by installing the Zoom application on your Android or iPhone device. We will now review the steps to downloading the application and connecting with your provider using an Android device. The first step is locating the Play Store on your device. Next, search for Zoom. Locate the Zoom Cloud Meetings application and install. Once you have successfully installed the Zoom application, you can either access your appointment from the texted link or utilizing the personal meeting ID that is provided from the clinical team at Crystal Run. I'm now going to review the steps on how to join a telehealth appointment if provided the personal meeting ID. The first step is to open up the Zoom meeting on your device. The next is to click the blue Join a Meeting button. The next step is to enter the meeting ID that's listed, given to you by the clinical team at Crystal Run Healthcare. The next step is to enter your name in the next box down. This will ensure that the provider knows it is you that is joining the telehealth visit. The next step is to click Join Meeting. You will then be prompted with a series of permissions. The first permission is to allow Zoom to take pictures and record video. Although Zoom asks for permission to record video and audio, we at Crystal Run have purchased the HIPAA-compliant version of the application and are not actually recording any portion of your visit. Make sure to click Allow on these permissions. The next step is to click the Join with Video button. You will then be entered into your provider's waiting room. When your provider is ready to start the visit, they will admit you into their Zoom meeting. Once admitted into the meeting, you want to make sure you click the Call with Device Audio button so that your provider has the ability to hear you during the telehealth visit. You will then be prompted again for one more permission. Make sure you allow Zoom to record audio. Again, because we are using the HIPAA-compliant version, there is nothing that will actually be recorded for this appointment. You are now in the appointment with your provider. We are now going to review the steps to download the application on an iPhone device and also how to join the Zoom telehealth appointment from an iPhone device.
First, you will locate your app store on your home screen. You will then type in the Zoom meeting. Zoom Cloud Meetings is the one you would like to download and select. Once your Zoom app is downloaded, you will be able to join with the link that is sent to you via email or text 15 minutes prior to your appointment. If you do not receive that link, you can also join via the provider meeting ID that will be given to you by the clinical staff. You will select Join a Meeting. You will enter the provider meeting ID. Once that is completed, you will then go to the next bar and change the default name to your personal name. This will allow the provider to know who you are once you are joined in their meeting. You will select the Join button. Zoom will now ask you for certain permissions. The first one that will prompt is access to the computer. You will hit OK. You will join with video. It will then ask if you are giving permission to join with a microphone, and you will select that as well. Both of these permissions will give the provider access to seeing you and hearing you during their Zoom meeting. Once you have selected both of those permissions, you will then be in your provider's virtual waiting room and wait for them to admit you to the meeting.
Now, that was an example of one healthcare organization's platform. Each organization, healthcare organization, offers different platforms. So it is, be advised to ask them for maybe a tutorial link or, some kind of instructions prior to your visit. So ask your healthcare provider. These are a few questions to keep in mind. So we would like for you to ask your provider, how do I make a telehealth appointment? How do I access the patient portal? Because a lot of these things can be a little confusing once you go to those websites. Is there a link or app that I must connect to? And as we saw in the example, they'll send you one via text or via email. Also, another question, will someone call to verify my appointment and connectivity prior to the appointment day? And one of the practices that I was in, the MA or tech support would actually call the patient the day before to make sure that there was connectivity. Also, will a medical assistant be coming to my home during the visit? In my practice, a medical assistant would come to the home first, help the senior open up the application, and then would stay there with the senior throughout the visit. But each organization is different. Also, another question, should I click on the link 5 to 10 minutes before the visit? As we saw in the example, they wanted you to log into that link at least 15 minutes before your visit and then remain in the waiting room. And then lastly, is my copay due at the time of the visit? Just please be advised to ask that when you make your appointments, because sometimes copays are due and sometimes not. But it all depends on your healthcare provider and your insurance. Thank you.
Thank you so much, Dr. May. Now we'll have Josephine Messelmani talk about Senior Telehealth Connect.
Thank you so much, Dr. May. Very powerful and important information. Really appreciate your time. So when we talk about Senior Telehealth Connect here at Detroit Area Agency on Aging, better known as the AAA, I'm so excited. So please forgive me if I appear to be oozing with just, this is the greatest thing that I believe that we have provided for seniors, and we're looking for other ways and other means to expand our program. So what is social determinants of health? And that's kind of like a buzzword going around, but it's been here for as long as I've been a nurse, or nearly 30 years, right? So we just now are grouping them together, but we have had problems with diabetes, hypertension, those things that has caused so many people to be living uncomfortable, or the longevity of their life has been shortened. So what do we do about this? We're going to try to triage the patient and refer them to needed resources in the community. And sometimes to do that, if we take the telehealth route, we can identify those early on and ensure that you get the help that you need. Next slide, please. What are the core services here at Telehealth Connect? Well, we kind of try to manage your disease processes. With that in mind, the chronic care management, like I said, there's many of them, but we are now focused on diabetes, hypertension, end-stage renal disease, some type of skin disorders. However, we can identify and help manage any problem that you're having. So these are just some examples of how we can make sure that once we get you in our program, you are assessed, and then we can move on to identify what you need. And early on, I told you about remote patient monitoring, which is huge for me. This allows us to come into the home, if invited, to teach you how to use, for example, the DiaScan, which is going to take your blood sugar, also the blood pressure cuff. And we also have a scale, which is great because now this is the key part of all of this. It is wireless. It will be able to take your results, place them in your file electronically, and then we can create a clinical report card for you as the patient, transmit this information to your healthcare provider if this is what you want. So basically, we're not trying to take the place of your primary care provider. However, if you would like for us to do so, we can. We're offering you a substitute in emergency care thing that you need. Sometimes if you woke up in the middle of the night, you're not feeling well, you may have now the flu and you want to speak to someone, well, guess what? You can call us. We are open after hours and on weekends. Next slide. Additional services here at DAAA. We do have our telehealth program, which we're talking about today, but I wanted to make sure that you knew that we have other services. We're best known for our preventative care management. We provide annual physicals, medical nutrition, home delivered meals, respite care, and the like. I won't go through every one on the list, but if you were to know that you have just at your fingertips any type of care, any type of assistance that is needed, and if we can't provide it, we also have a referral process, which also is great. We will do everything in our power to help anyone that we can. Next slide. This is more about the remote patient monitoring. I just want to tell you, I'm just in love with this part of the program because it offers so much, and we will be able to explain to you in detail if anyone wants. Next slide, please. What is the target population? Right now, Medicare, Medicaid, other health plans are also welcome. We have veterans in our program, 2 or more chronic diseases, age 65 or older, adults with disability, and anyone that requires support managing comorbid diseases. Now, Here at DAAA, we do not have a copay program. Your visit is free as long as you have Medicare and Medicaid. So we make sure when you call us up and we talk to you about your insurance information, and sometimes we are using a method where you know that it's us, because we tell people all the time, when people are calling you, do not give your social security number or your Medicaid or Medicare number. This is your private information. If they were truly trying to help you, they wouldn't be asking you for that information over the phone. Because even with the remote patient monitoring devices, we will come out, we will instruct you how to use it. And at that time, you will have our identification. You will also see us in person, and you will know that you can trust who we are. Next slide, please. Who's on the staff? See, that's one of the things that people need to know. We are a group of certified, credentialed specialists. We have a medical director, a nurse practitioner, registered nurses like myself. We also have a registered dietitian who is awesome. She actually provides classes on how do you cook healthier? What are some of the foods that you should buy? What time of day or night should you eat or should you not eat, so to put on unwanted pounds? We have licensed social workers and case managers. This is one of the ways that whatever situation or problem that you're having, we can direct you to the right personnel to solve them. This has been awesome. Thank you so much. If you have any questions of Dr. May and I, please do so at this time.
Are there any questions for Dr. May? And Ms. Messelmani? Thank you so much for providing us with information about telehealth today. We're thrilled to have you, and it was very informative. Thank you so much.
Thank you.
Thank you.
Thank you for having me.
Thank you.
Thank you.
Now we'll get ready for our next presentation on grocery shopping, online grocery shopping. And with us today is Joyce Holly. She's the benefit navigator at St. Patrick's Senior Center. And I would like to extend my gratitude to St. Patrick's Senior Center, who was very instrumental in providing us with a number of presenters for today's expo. Ms. Holly?
Thank you, Ann Davis. Thank you all. I'm so excited. Can you see me?
Yes.
Okay, great. I'm so excited to be part of your presentation today. Thank you so much for the invitation. We're going to get right into it. If we can go to the next slide. Grocery shopping online. I have 5 easy steps. And I know that sometimes we feel that grocery shopping online or shopping online can be very difficult, but that's not the case. It is very simple, and I'll show you in these steps today. Most major grocery store chains have online ordering options. Usually it's easy as going to their website or looking at the top menu on their website. Depending where you live, they will give you options for grocery pickup, and sometimes even delivering to your home. Many chains offer free grocery pickup, either same day or next day. While some will charge a small fee, sometimes busy times cost a fee, while less busy times are free. Most delivery options do involve fees and also tips for your driver. You will see what is available to you on your grocer's website. Check with your chain for the specific terms. Next slide. Benefits of shopping online. Shopping online can save you money. Yes, it can save you money. Avoid crowded stores and long shopping lines, and it can also provide you with contactless shopping. Next slide, please. How to get started. Let's get started by first creating a shopping list. This will help us save money because when we're online, we'll go to the specific things on our shopping list and we're not can get involved in the things that they set up, the traps in the stores, that we pick up those extra things. We can stay strictly to our shopping list. And this is a priority. So before you go shopping online, you can put all the things that you require in your cart. We want to next go to the official website of the store you would like to shop. Be sure that that name appears in the browser. And that's very important because you can shop online at the specific grocery store of your choice, but there's also third parties that are out there that that may charge extra fees, and you can avoid those by just going right to your grocery store. For this demonstration, we will use Kroger's. Next slide. Creating an account. As you can see, on an example here, we have the Kroger website, and on their website, they have a little man to your right that says sign in. We just want to click on that. You drop down and you can create an account there, and you click create account. Next slide. As you're creating an account, of course, you have to put in your information. You will put in your first name, your last name, a valid email address, and you can set up a password. And I know that sometimes it's hard to veer off your password, but I do highly suggest for security reasons that you will find a password that's just for this website, not one that you use for your bank and personal information. Also, on the next, right here next to it, you can also, if you're a shopper at Kroger's or some of the local chains, you can put in your bonus card number. And then that will allow you, for Kroger's, it's a plus card, and that'll allow you to still get coupons and special deals. Next slide. Once we've created an account, we will next like to start by picking the grocery store that you would like to shop at. So you can enter your zip code and locations will come up. For this example, we're shopping locally here in Michigan and in Detroit area at the Kroger's in Oak Park. You can then decide if you're going to pick up, if you're going to have a delivery, or if you want your items shipped, or if you're going to go in store to pick up your items. And you just kind of click on one of those, and we're going to stick with pick up. So we will click on pick up on the slide there. Next slide. Once we selected our grocery store, now we can start shopping. At the top of the screen, you see where you can just enter in the first item. I entered in apples, and a selection of 1,800 results came up for apples. So if you want a specific apple, you can say, I like Gala apples, Fuji, whatever your items, the more specific you are, the less choices you have, and it'll bring it easier for you to select your items. You want to just add to cart. It's that simple. If you want to add more than one item at a time, you write add to cart. While each store is a little different, the basic process is the same. First, you search your items, and then you add them to your cart. Next slide. After I've selected my items and I'm finished shopping, I'll go to my shopping cart, which is up in the upper right corner because we're using Kroger's, and you can click that and it'll come up with pickup cart. There you will see all the items that you added to your cart, and it'll give you a summary of how much your groceries are. You can always view and edit your cart while shopping. At this time, you want to go to the next slide. I'm sorry. Now, once we edit our cart, we're going to go to step 2. This is the part where we're going to be checking out. So once we check out, you want to select a day and time. When you're ready to check out and are prompt to pick up or delivery time, normally there will be plenty to choose from. However, during holidays and emergencies, you may have limited times to choose. So you see, I selected Friday, and I want to check out between 9 to 10 a.m. Next slide. One tip is, if by chance there's not any time slots, try again in a few hours or the next day. If you've made an account and you logged in, your items in your cart should save until you can find a time slot. Next slide. Now we're going to go to step 3, where we're going to finish up checking out. Before we check out with your credit card, most stores will ask if you allow substitutions on items. Most stores default to allowing substitutions. However, if there are specific things that you don't want substitute, you can usually opt out by unchecking those items. For instance, you may want Sara Lee whole wheat bread. If the store is out of the Sara Lee whole wheat bread, then they may provide you with their brand name, Kroger's whole wheat bread. And if that's not an item you don't want, then you can just, at that time, you can just put that no substitutions, I only want that item. Also on this screen, you will go ahead and start putting in your information to check out. Next slide. This is what I was talking about with the substitutions. And as you can see, under each item that you have in your cart, you can click for substitutions. Next slide. Once your time slot approaches, an employee will go and handpick your items and set them aside for you. If an item is out of stock, again, they will try to substitute it. Or if there's no suitable substitution, they will just deduct the items from your bill. You will usually get an email or text about any out of stock or substitutions before it's time for you to arrive. And as you can see, there's a little note that says your order items that are unavailable. We have items for substitutions. Here you will click, this will come over your mobile phone, and you can click there and say yay or nay to any of the substitutions. If you're doing grocery pickup, the store will send you notification that your order is ready. You simply drive to the store, park in a designated spot. They usually have a number you can call to let them know you're there. You do not need to get out your car. The employee will load the items in your car for you. All they would need from you is a signature. And you can see, they will text you, your Kroger pickup receipt is ready to view. And that's it. Any questions for online shopping?
Is the credit card needed or a debit card in order to grocery shop?
Yes. When you're going to check out, you will put in your credit card number at that time after you've selected your shopping cart.
Thank you. Are there any other questions? Thank you so much, Ms. Holly. Really appreciate your information that you shared today.
You're welcome. Thank you so much.
Now we'll have a presentation from Kathi Sitek. She's Vice President of Business Development, and she's also a certified financial coach. She's with Diversified Members Credit Union. Thank you so much for being available, Kathi.
And thank you for having me today. I'm really excited to present on Diversified Members Credit Union and talk a little bit about our online and mobile banking, which is, I feel, very convenient in this day and age. Sometimes we need to go into the bank or the credit union for different things, and I'll explain that today. And sometimes it's most convenient and secure just to use your laptop, your tablet, or your mobile phone. In this workshop, our goals are to identify ways to use mobile banking in your life, use mobile banking safely and securely, and decide when to visit a branch location or just use your mobile banking. Next slide. Next slide. So the next slide, please. So what is online and mobile banking? Online mobile banking is making financial transactions on a mobile device or your computer or your tablet. And it is separate than conducting your business in a bank or a credit union. Mobile banking services are receiving bank alerts on your phone. In-person banking is speaking to a financial advisor, getting a safe deposit box, applying for new investments, getting a new bank account, or applying for a loan. But you can use both to check transactions that you've recently made, to view your balances, to transfer funds, to make your bill payments, to report lost or stolen cards, credit cards, debit cards, to deposit your checks, and just to check your checking balance. Next, please. When should you go to a physical bank? So many people go to their branch office of their bank or credit union to apply for a loan. We do have the capability of applying for the loan online, but many people like to just talk one-on-one to tell that representative their needs and to see the rates. And that's something you may want to physically go into your financial institution to discuss. Applying for and opening a new account. Many times we need to establish your identity. So we'll ask you to come in with your ID for applying for different accounts, but we also have an online process that we use. Applying for new investments. We have investment brokers that can come to meet you at the credit union or your financial institution to help you with different investments, as well as financial services. I am a certified financial coach, and I meet one-on-one with our members and non-members and talk about budgeting, savings, and credit scores, and how to build your credit score, to understand more about your credit score. And these are the things that we like to do one-on-one in our branches. And getting a safe deposit box. So why would you use mobile and online banking? Well, it's very simple and flexible. You can access your accounts, you can transfer money, you can make payments, and you can do this on the weekends when your financial institution is not open and on holidays. It's very secure. Many people are always worried. I know my husband was always worried about his mobile phone, that someone would try to get into his account, but it is very secure. In this day and age, our credit union and your financial institution takes very great care of their firewalls to keep you safe and secure, and to keep your information safe and secure. It can also improve your ability to monitor your finances. So I feel like with my mobile app, I am actually alerted every time I do a purchase with my debit card. It comes across on my phone. It tells me where I did the purchase. It gives me the amount that I purchased, that was cleared. And this is done immediately. So if you have any question at all, if someone's using your debit card and this comes across your phone, I actually have a personal story. One night about 6 months ago, I was going to bed at midnight and my phone beeped, and it was alerting me that a transaction was coming through. So I looked at my phone, and it was from California, and it was a transaction for $1.99. And I knew that seemed odd. So the very next day, I called my representative at my credit union and told her what happened, and she checked into it. And she said many times when your card is compromised, it'll start with a small amount, the user, to see if they can use it. So she shut down my card immediately. And that protected me and my funds. So using mobile banking is amazing because it is real time and it notifies you immediately. Next slide, please. So let's talk a little bit about depositing checks using your mobile banking. I know it took me a long time to really decide that I wanted to use that, but it is very convenient. So here are some scenarios where you could use the mobile banking for your depositing your checks. You have a check and you need to deposit it, but you're really unable to go to your bank or credit union. You don't have time to stop by an ATM machine, or you just want to deposit your paycheck or some type of check immediately. You live in an area where there is no bank or credit union close by. It's a Sunday or a holiday, and your bank or credit union is closed. You need to deposit a check right away because you have some bills due. So if you're talking to your financial institution about depositing your checks online through mobile banking, here's some questions you need to ask. How long does it take for the money, once you scan your check on your phone, to be deposited into your account? At Diversified Members Credit Union, it takes 1 business day because we do have to look at the check and we do have to review the transaction. Is there a limit to how much you can deposit each day? We do have a limit. It is $2,000 per item and $5,000 for 5 different items. So that is our limit for the day. You can call the credit union or your bank if there is an exception and you need to speak to a representative. Are there restrictions on different types of checks? The restriction at our credit union is there are no government checks to be deposited, and also any second endorsed checks are not deposited through mobile banking. So if it's a check made out to you and your spouse and you need 2 signatures, we would have to have that. Both people come into the credit union with their ID in order to approve a large check like that. So these are some of the questions you may want to ask. Next slide, please. So what are mobile wallets? Now, that can be confusing to some people. So a mobile wallet is a smartphone feature, and we all have it. And sometimes we are not really sure how to use it, especially in this day and age when you're using it for tickets. I know that was very confusing to me. Like if you're going to the Detroit Tiger game or you're going to a theater and they send you everything through a mobile barcode, you can actually keep that by downloading the app that they give you into your mobile phone, and then you can use that to pull up the tickets. So there are steps to do that, and you will always learn that through your provider that gives you the tickets. You may want to make a purchase online, or you may want to use your mobile wallet just to be able to do a debit. And you can use, we have Apple Pay, which you can use, where you download your debit card into your Apple Pay, and then you use that by tapping your phone to the purchase at a point of sale. So a mobile wallet can be used at a point of sale. It can also hold the currency of your debit card, but a mobile banking can transfer money between accounts. So if you have mobile banking on your phone, you can download the mobile app. I have the DMCU app, and with that, I can transfer money. So for instance, it's very convenient if I'm using my credit card And then I decide right away that I would like to pay that credit card transaction off and not wait to my statement. I can go right into my savings or checking through my mobile app, and I can transfer the money over. And it's very simple, and it saves you time, and you don't have to go into your financial institution to do that. And both your mobile wallet and your mobile app can be used for online purchases, and it can be used for in-person purchases, and it can be managed through multiple locations. It can also hold your currency. Next slide, please. So, how do you enroll in mobile and online banking? It's pretty simple. You can talk to your financial institution. I know at our credit union, you can call our call center and they can walk you through that. It's very simple. They can help you set up a password. One thing that's really important is when you are setting up your passwords for your mobile banking, that you make sure that it's a strong password. And I actually looked this up to be sure, and I do tell my membership this as well. When you're setting up a strong password, you should always have one uppercase letter, one lowercase letter, at least one number, and at least one symbol. And I would suggest up to 10 or more characters. And make sure you keep those passwords in a safe place so that you know where they are in case you forget, and so that no one else can see what your passwords are. You would download your app from the website, and you would set the secure password, as I said, and you can also set up a mobile wallet. Now, I have the mobile wallet set up for myself, but I don't really use it. I just use my mobile banking because to me, I can see every transaction that I have, and I can look multiple times during the day if I would like. It's just as simple as putting your password in and your security question, your answer to your security question, and getting right into your accounts. And that saves you too when you're out shopping and you say, hey, I'm wondering if I have that money in my checking account. You can always, I step out of line and I just look really quick. I get onto my mobile banking. And if I have that balance there, then I feel confident enough to go through with the transaction. So the 6 best practices for staying secure. Use a strong password, as I said. Please keep it secret. Always use secure internet connections. That's very important. Verify who you are communicating with. If someone contacts you online or claims to work for your financial institution, contact your financial institution immediately to make sure that person is actually a representative. And so for myself, I do a lot of outbound calling in my job where I call my membership, and I always state who I am, first and last name, the financial institution that I'm calling from. So if they have any questions, they can always call the credit union. I also give them my phone number if they need to call me back. But if they need to call the credit union to verify who I am, I want to make sure that they feel secure talking to me. Download the mobile app from a trusted source. So in your marketplace on your phone, you can find our mobile app. So I'm sure you'll be able to find your financial institution's mobile app. So you should download it from there and regularly monitor your accounts and your transactions. It's really important. And that's why it's nice to have mobile banking, or use that on your tablet at home, or use that on your computer at home. Do that so that you can monitor what you have out there and also all of your transactions. Our credit union goes one step further, and we actually have what you call Savvy Money, where you can monitor your credit scores. You can monitor your credit report just by looking at your phone, and you can sign into that through your mobile banking. I love that, and as a person that does financial coaching, I love to be able to talk to our membership about that. So today you learned how to use mobile banking, how to use mobile banking safely and securely, and how to decide when to visit your location or use your mobile banking. Are there any questions at all?
What's the difference between a bank and a credit union?
Oh, awesome. Thank you for asking me that. So being in the business, in the credit union business for 40 years, I love my credit union. And I can tell you that a credit union is, well, first of all, our theory is people helping people and not for profit. A credit union is a nonprofit organization that's owned by its members. A bank is for profit. The people that run the bank, that sit on the board of directors, are paid individuals. Our board of directors are volunteers. Everything we make as profit, we give back to our members in better interest rates, lower rates, and definitely lower or no fees. If you are a member of the credit union, you own the credit union. You can vote, you have rights to vote. You can make suggestions, and we have an interest rebate program. So everything you pay out in interest, as well as some of the interest you get back in your savings, we actually rebate you once a year and give you an additional rebate on the things that you pay out in interest. Because our credit union has a great reserve, but we make sure that our membership gets what they need, and we give back to our membership. We also work great in the community. We love to serve people. We love to help them with their finances. That's my job, to be able to go out and educate people in the city of Detroit and the local areas and teach them about financial literacy. Thank you for asking that question.
Thank you. Are there any other questions? Thank you so much, Kathi, for making yourself available today. Your presentation was very
informative. We have a question in the chat.
Okay.
From Denise Davis. Good morning. What are other names used for internet wallets? Sounds like it might be good for making online purchases with increased level of security.
So what are the other names used for an online wallet? Okay. Actually, I just have it down as a mobile wallet. Apple Pay is one of them for sure. And this is the one that our credit union uses. So I guess you would have to find out from your own financial institution what avenue they use for a mobile wallet. I know we use Apple Pay. Not every, so whatever your provider, your internet provider uses and your core system uses, that's what we interface to. If that will answer the question. And it is safe and secure, and debit cards are safe and secure as well, especially with mobile banking.
Thank you.
Does it answer your question?
Yes, thank you.
Okay, thank you very much. And thank you for the opportunity. Anyone that needs financial coaching can always reach out to me.
Thank you so much. And if anyone else has any other questions, please put them in the chat and we will get to them after this last presentation. Thank you so much. Now we have Darlene A. Garcia with us today. She's interim president and CEO of Elder Law of Michigan. She's formerly director of community services and also over My Cafe. Darlene,
yes,
please join us.
Thank you. Thanks so much for having me. And I'm ready to do the presentation. I don't see the screen. I just see names. So perhaps, there it is, coming back. Still don't see it. I think it's coming.
It'll be up in a minute. And I'm so thrilled that you're here today to talk about the 5 key benefits for seniors, because we know that if seniors apply for those benefits, they can add about $5,000 to $7,000
yes.
to their bank account or credit union account on an annual basis. So thank you so much for being available.
I am happy to be here, like I said before. And I just want to emphasize before I start the presentation, this is an overview of the benefits that we screen for individuals that are eligible to apply for those benefits. We do provide the assistance over the phone. As if you are not aware of, Michigan has an online platform that allows for the creation of those applications online. We here at MyCafe can help you apply every step of the way, and we'll guide you through that process. We know that technology can be a challenge at times, and so we are there with you every step of the way to help you apply for the benefits. Having said that, I wanted to say to you that my name is Darlene Garcia. You heard the introduction before. I won't labor you with that. I'm here to present to you the 5 key benefits that our MyCafe program does whenever an individual calls our system. And this is what we do. Next slide, please. All right. Went too far. There it is. So our MyCafe stands for the Michigan Coordinated Access to Food for the Elderly. We are here to help individuals that are 60 and older. We help them apply through an application assistance, and the assistance is provided to you over the phone. We partner with local organizations. So if you're not comfortable dealing with someone on the phone, we tend to connect you with a local organization to help you with the application process if an organization is there. I do want to let you know that if you know someone that needs assistance, please do reach out. We are here to help. We will try to connect you with whatever resources that you may need. Next slide, please. I think you have to click all the way through. There is a lot of graphic there. So the 5 benefits that we're going to be talking about are the SNAP. It's also known as the Supplemental Nutrition Assistance Program. We will talk about the Medicaid, the Medicare Savings Program, the LIS, or the Medicare Extra Help Low Income Subsidy, and the State Emergency Relief, also known as SER. Those are the 5 key benefits that we screen individuals. There are other benefits that we also do, as we are, when we get a phone call, we get a question and survey that allows us to identify what benefits you may be eligible for. But the topic of today's presentation is to give you an overview of those 5 benefits showing up on the screen. Next slide, please. One of the things that I will talk to you about is SNAP, and what is it? SNAP is the Supplemental Nutrition Assistance Program. It is a federal program that provides nutrition benefits to low-income individuals and families. SNAP is important in that it provides that needed assistance to low-income seniors and people with disability or living on a fixed income. One of the things that is stated on that slide is from our experience, we know that over 48% of seniors are eligible for SNAP, but they're not applying for it. There are barriers that are built in a system that with our the level of work that we've done, we know that there are levels of barriers that are built in a system that won't, the seniors have a hard time overcoming those barriers. And we're hoping that if you are facing those barriers, do reach out to us and we can help you get the needed assistance you may need. One of the things that is reflected there we know that seniors that are facing hunger have an increase in developing health issues. So that's why it's important, if you need assistance or you know someone else that needs assistance, to reach out. Next slide, please. With SNAP and the one of the eligibilities that we look at SNAP, and this is an overview of eligibility. The things that SNAP looks at is gross monthly income. Right now, household is underlined because it's a key feature in the eligibility process. So for household, is those individuals that cook and prepare meals together, and then therefore when they apply for SNAP benefits, they are deemed to be a household. The gross monthly income right now is 130% of federal poverty level. That's what they look at to determine whether or not you should be able to apply for SNAP benefits. Households that have a senior disabled or a disabled veteran are allowed to use 200% of the federal poverty level. And the next slide will show you what that income guideline is. The next item is net income, and net income is important as it determines the amount of benefits that you are going to be getting in your bridge card. There's a picture on the slide. If you were not aware that that's how it looks, that's the intended purpose of that that image. That's the bridge card. That is the card that most individuals receive their benefits. It gets loaded in there, the amount of benefits that they're eligible for, and then they get to use that bridge card and grocery store to purchase food. The eligibility requirement for SNAP, it looks at asset limits. Currently, it is set at $15,000. And the next item, there are other eligibility. For the most part, this would be the key features of eligibility. It looks at citizen. It is indicating that it's U.S. citizen or certain lawful permanent resident in the state of Michigan. If you feel you have doubts as to whether or not you're eligible for, if you make a phone call to our organization, we should be able to walk you through the process. And next slide, please. All right, so this is the SNAP eligibility overview. As mentioned before, one of the criteria that look at is household. So those that live together and purchase and prepare meals together are consider household. And so if that is true, say for example, 2 individuals are there, that household will be 1 applicant that gets submitted in there. They will look at asset at $15,000. The gross income that they need to be showing is at $1,396, or if they have a senior disabled individual or disabled veteran, they get to use the 200% of the federal poverty guideline, and that is set at 2148. Federal poverty guidelines or levels are changed either at the beginning of the year or mid-February, but it's issued every year and it gets adjusted to reflect there. So that number may change every year. The net income is set to be at 100% of federal poverty level. Right now it's at 1074. Keep in mind that net income becomes important in that it gives you the, wherever you fall in that category, net income makes a determination of how much benefits you get based on that. There are some allowable expenses, and one of the things that are allowed in that category, it ranges from a 20% deduction for earned income, a standard deduction currently is set to 177. So the math is you show a gross income and then those deductions get taken out, and then you get the net income that determines the amount that you get to take as far as benefit is concerned. One of the things that I wanted to highlight in expenses is as of April of 2021, before we didn't have this, there's a standard medical expenses for a senior disabled or disabled veteran. Before, seniors had to prove that they had medical expenses incurred for them to sort of get that standard deduction. As of April 1st, 2021, a senior or a household with a senior, disabled, or disabled veteran household can only prove or just have to show that they have a medical expense of $35 or more. If they're able to show that, they get a $200 standard deduction. They get the 35 plus the 165 standard deduction. So it's really important that even, there's a whole category of things that are considered medical expenses, and we can help you identify them and we can walk you through that process. But the threshold is to show 35. And then once you show that 35 medical expense, you get that 200 deduction. It brings it down from gross, deducted, and then net income is reflected. And then citizen, we talked about citizen and nothing further there. Just make sure that it's the citizen is a eligible status based on the guidelines that is provided. Next slide, please. Okay, the next benefits that we screen for is the Medicaid. So the Medicaid is, there are different levels, and I don't want to confuse the conversation, but there are different medical and medical aid Medicaid term. The one we're talking about in this slide is the regular Medicaid, which is for the aged, blind, and disabled. Is an entitlement medical assistance program, which means income and asset eligibility requirement must be met to receive that assistance. Medicaid program is to ensure that essential health care services are made available to those who otherwise could not afford them. Medicaid is also in the state of Michigan, it's MA, it's called medical assistance, and that's where it falls in. And next slide, please. As done before, Medicaid eligibility, an applicant can apply based on a single, married, both can apply, or an individual applying for just one. So if a married individual decides to apply for one, they can do so, and then they have an asset that is required to meet. For a single, it's $2,000, married, applying single or both is $3,000. There are levels of income that it needs to be proven. For those that are very low income at 100% federal poverty level, for singles, $1,133. For married, applying one or both is at $1,526. Then there's the next level of income eligibility for Medicaid is the low income threshold at 33% of federal poverty level. It is $1,506. For married is $2,029. Citizenship is required. In this citizenship category, it looks at Michigan and also the US citizenship or certain eligibility status for that category. Next slide, please. So the next slide talks about Medicare and Medicare savings. And what I want to sort of emphasize, Medicare is a health insurance program that is available for person who are 65 or older, have a certain disability, or people with end-stage disease, excuse me. And the Medicare is a federal health program. What tends to happen is Medicare has different parts. So if you're eligible, you can either be in the category where it is paid, or you have to pay for that premium. So Medicare Part A, if you are eligible, it is paid for you, and one of the requirements is the individual has done payroll taxes for about 10 years or more. And then they meet those categories, and Medicare Part A is paid for that individual. If that person does not qualify for the premium to be paid, then they can purchase that health care right now is set to $499. If they pay, there's tiers in there. So if they have a record, Medicare taxes paid for less than 30 quarters, or a certain level is either a $4.99 premium or $274, depending on where they meet in the criteria. For so Part A consists of hospital insurance. Part B is medical insurance, and this is where doctor service, outpatient, and medical supplies come in. There's a premium for Medicare Part B, currently listed at $170.10, and that tends to go up every year. It gets announced. And then Medicare Part D, which is the prescription drug coverage, and we'll talk about it more as we deal with the other programs that we help with. So Medicare Part B, which is the medical premium of $170, is where the Medicare Savings Program come in handy, and the Medicare Part D LIS comes in handy because both of those two programs allow for apply for the to see if you're eligible, so that your 170 is not deducted from your you don't have to pay for those premiums. Next slide, please. Okay, so Medicare Savings Program. Medicare Savings Program is a Medicare premium. It helps you pay for that. In 2021, there is a $20 disregard. You see numbers that are different. If you were to look at the low income poverty, $11.53, you won't find it. That's because $20 is included in there. And so for Medicare, let me get bigger. So for Medicare Savings Program, you can have the individual or the couple apply for it. There is a asset requirement for SSI Medicaid. Asset is $8,400 or $12,960 for couple. The $84,000 and $12,960 you see reflected there does not include a $1,500 burial expenses that get automatically deducted. So an individual can have 84 plus that 1,500 for burial expenses and still meet the asset requirement for SSI related Medicaid. All other asset for all other non-SSI related Medicare Savings Program, the asset is at $2,000 or at $3,000. Very low income, those are at the $1,153, and for couple at $1,546 will get their Medicare Savings Program fully cover, and that is that $170.10 that we talked about in the earlier slide. So if an individual is at that income level, it meets the asset requirement, they're in as far as getting that full coverage paid. If however, they are in the, and if you noticed, I put it .01. They do look at it at that level, that minute level. So if an individual is showing 1153.1, they are not at 100%. So they are looking at it at the 100 through 120% of federal poverty level. And so if you are in that category, then Part B is paid on a partial basis, and you will know how much is getting paid by the state, and then what you have to pay. Citizen requirement, the same. Michigan, you have to show that you are a Michigan resident and that you are a U.S. citizen or you meet certain eligible status. Next slide, please. All right, so with the Medicare Extra Help, this is where I was referring to with the, we talked about was the Medicare Part B was that premium, and then Part D helps you with prescription drug coverage. There is LIS, which is what the program is, and so to be eligible for that, you can either be an applicant of an individual or couple. You have to show assets no more than 15,510, and For an individual or for a couple, it cannot be more than $39.50. And they do look at the income. If you are at the 100%, obviously you'll get covered. This is for partial Medicare extra help assistance. And so at that 135 is $17.19, or for a couple, $23.09. Next slide, please. The other and very last benefit that we speak about is the state emergency relief. The state emergency relief program is it's a state program that provides financial assistance, money for to quickly remedy an emergency. Such an emergency can be an eviction, stop a utility shutoff, or pay for burial. There are other guidelines that are listed under the state emergency relief, none of which I will talk on this, but there are a whole list of other things that the SCR covers. To be eligible, it is based on household composition, and the monthly income is an individual can apply or a couple can apply. Asset cannot be more than $15,000, sorry, and income must be at 150 federal poverty level. The income is listed at $16.99 or $22.89 for a couple. That concludes our, well, actually, there's another slide. If you can go to the other slide. So I wanted to leave my presentation with this information. If you have, any questions regarding eligibility for the benefits that we apply, do give us a call. We are open. Our call center is listed there. We're open Monday through Friday, 9 a.m. to 3 p.m. The number there is our call center number, and we're here to help you if you have any questions. The very last slide, and you don't have to move on to it because it just has my name. But I rather have this slide up so that it has the contact information. Like I said, we do help with online applications. So if you have questions about whether you are eligible to apply, please reach out to us and we're able to help you. That is it. Thank you so much. I'm open to any questions.
Thank you so much, Darlene. There is a question in the chat from Denise Davis. She's asking, is an individual has a special need trust or ABLE account, does those funds count towards the stated asset or income?
So it's interesting because I can tell you that ABLE is a special needs asset, and it generates the enough income to allow for that individual to sort of live on a day-to-day basis. So asset will not be an issue because that individual does not have the right to sort of invade the ABLE account. It is control in that regard. So asset is not going to be an issue. My understanding of the ABLE account is that it gives you just enough to allow for you to sort of, be eligible for state benefits. So ABLE just issues, a monthly check that allows you just enough to allow you to be part of the sort of, if you need Medicaid, that's something that you are able to get. ABLE allows an individuals to manage and sort of run their own life as an individual in a community. So ABLE was intended for that. It is intended so that it does not affect eligibility for public benefits. So my first instinct is to say it should not affect you, because of the very essence of creating an ABLE account is to allow for that individual to be able to control their funds and not be impacted by having too much of asset or income coming in that they're not eligible to apply for state benefits.
Thank you so much for that. I think that there may be another question. assets and able amounts can be over 50,000 or more.
That's correct. But the terminology enable account, the trust is created. The trust is created, is managed by someone else. The individual does not have a right to invade the assets of it because it's been transferred to a trust. So they don't have a right to those assets the way that you and I think of assets as having the right to dispose of it. So this able account should not affect that.
Okay. Do you find that some older adults don't understand that they have to apply for MSP or LIS annually? And
Oftentimes we do that. We hear that all the time. What we tend to get is individuals who are paying for it, where they paying on a monthly basis and they don't know that there's an opportunity for them to not pay. So that means extra money in their pocket. So when we get an individual that calls in, one of the things that we look at is what other expenses do you have? What are you paying? And so we then make an analysis of, okay, maybe we can help you apply for this, and we catch that individual in that regard. So we often see that, unfortunately.
Here's another question in the chat from Katrina Collins. If a person is a senior and they sell their property, will it affect them getting Medicaid and food stamps?
So what I would suggest, and full disclosure, I am an attorney. What I would suggest is that you seek guidance with a estate planning attorney that will allow you to get these answers correctly. There is potential for impacting your Medicaid and your eligibility to other benefits. So I highly recommend that you seek out a estate planning attorney that will give you all the sort of four corners of what you need to be looking at to maintain your eligibility. Selling an asset, it will impact your eligibility.
That's good to know. Any other questions? For those on the phone, you can unmute yourself by pressing *6.
I will also add, selling or transferring asset will affect you. So just make sure that it's not just a selling where you're earning income. Giving it away, transferring to someone else does make an impact on your eligibility. So I do whatever you engage in, make sure that you are consulting with a Medicaid attorney or a Medicaid planning attorney that will help you with those plannings.
Thank you so much. Any other questions of Darlene? I think that's all of the questions. Awesome. Would like to just thank everyone for being a part of today's event. We really are pleased that you've taken out the time to hear from our speakers. I would also like to thank all of the presenters who have made themselves available to this Your Money Smart Expo. If you would like to set up an appointment to be screened for the 5 key benefits, please call Elder Law of Michigan at 1-877-644-2233. An benefits counselor can assist you with SNAP, which is also known as Bridge Card, Medicaid, Medicare, of course, low income subsidy, Medicare, extra help, and SER, excuse me. Now for future Money Smart events, please go to the www.semisrc.org website. And you can also put a message in the chat and we'll make sure that you're invited to our event next year or future quarterly webinars. We do have one additional webinar available this month on April 27th, and we will be hearing from our own Darlene Garcia once more. she'll talk about food for thoughts and all the food benefits that are available for older adults. And that'll be from 10 until 12 o'clock. Before we adjourn, we would like to announce winners of the door prizes. And again, I would like to thank our sponsors. I would like to thank Christy King, Michaela Brown, and Nicole Harvey, who really worked with the Benefit Access Committee. I also like to extend my thanks to Audrey Fry, who joined us today to facilitate the session. And all of our presenters, Josephine Messelmani, Dr. Indea May, Kathi Sitek, Joyce Holly, as well as Darlene Garcia. Thank you so very much for making yourself available. Now, I would like to announce 3 winners of our door prizes. These door prizes are being made available through Detroit Area Agency on Aging, Elder Law of Michigan, and the SRC, the Senior Regional Collaborative. The first door prize will be going to Miss Zhu XU. I think she's maybe associated with the Association of Chinese. And I see some other door prizes going to Valerie Pryor. She'll be getting the Elder Law of Michigan door prize. And then do we have a third door prize? The third door prize will be going to Mamie Burton. That will be the Senior Regional Collaborative gift card. These are $25 gift cards that are being disseminated to these lucky winners. Thank you so much, everyone, for being on the call today. We will make sure